for being with us today. You spoke about overhauling the healthcare system. To quote you, you said that the healthcare system is not effective. I know that the NHI is just one of a 10-point plan that the department has. If you could briefly, in a nutshell, tell us what is the overall plan? What is the overall strategy? Because there is a lot of people out there who feel that the Department of Health and healthcare in this country has let them down.
Yes, indeed, Peter. That's one of the reasons why, if you look at the manifesto of the ruling party, we said health and education are their top priorities for the next 5 years and beyond. It was recognition of the fact that something has gone wrong in healthcare in the country. And I've given you some of the reasons. The first one being this burden of disease that the country is carrying. The second one being problems in terms of management and healthcare financing, of course. So we did go through a diagnostic journey, which was led by the DBSA, the Development Bank of Southern Africa. A diagnostic journey to find out what's wrong. I'm not going to go into that, but I'm going to go into the solutions that will then reflect to you what went wrong. The solutions are what we call the 10-point program, meaning it has got 10 points. And the first one says we need to create strategic leadership, meaning that first of all, you need leadership at all levels. Strategic leadership and create a social compact with society for better health outcomes, meaning that there's recognition that the government can't do it alone. You need to create relationships in the form of a social compact. That's the first one. The second one is NHI, which everybody knows about in the 10-point program. They always know one point, NHI, and not the others. The third one is the issue of quality of health care, which I've spoken about in my speech. And the fourth is the fact that the management of healthcare needs to be looked into and be overhauled completely. And I'm sure you are aware that we are doing that. The issues of management, we have spoken about a lot, of having inappropriate people as CEOs of hospitals and who are in the leadership of the healthcare system without understanding anything about the healthcare system in the country. The fifth is about HR. It actually says the planning, the development, and HR need to be looked at. That's why we produced the first ever HR in health, a strategy for health. The first ever documents, pre and post-apartheid, was produced and unveiled in October last year at the University of Witwatersrand in recognition of that. The sixth is dealing with issues of infrastructure, which I've mentioned. And the seventh is how do we deal with the issues of HIV, AIDS, and TB, as I've mentioned. The eighth is mass mobilization. We won't achieve much, especially in fighting diseases like HIV, AIDS without mass mobilizing. And the ninth is reviewing the drug policy. We're not happy with the drug policy in the country. It needs to be reviewed completely, and we're doing so. And the last one is research and development, which lag behind many countries at the same level of development as us. Those are the 10 points. Now, from the 10 points, we developed the outcomes, which I've mentioned, in terms of the diseases, the disease profile I've shown you, that we need to increase the life expectancy. We need to decrease maternal and child mortality. We need to reduce the prevalence of HIV, AIDS, and TB. And lastly, we need to improve the effectiveness and efficiency of the healthcare system. That is why I mentioned 5 things, which correspond to the 10-point program. Yes.
Okay, so Minister, the plans are great, and we're often very good at coming up with great plans. My question to you, and we're going to answer this straight. Okay, my question to you is, do you have the people to do this? A lot of people, the comments that I'm getting is that your plans are ambitious and that perhaps you actually don't even have the buy-in from the provinces, that they're autonomous and they run themselves, and no matter what your plans you come up with, if they're not committed to it, this thing will collapse.
Well, provinces are not autonomous. I don't know what you mean by autonomy. We are one country with 9 provinces.
But this federal system makes it difficult for you to intervene sometimes.
No, South Africa is not a federation. It's not there's no, I don't understand what federal system, Peter, you're talking
All right.
about, because in the constitution there's no federation. But we meet with the MECs in what is called the National Health Council.
Right.
It's the highest decision-making body in the country, consisting of all the MECs and their HODs, the South African Health Military Health Services, that means the Surgeon General of the South African Military Health Services, and SALGA. We actually meet quite often, every 2 months, and we had our last meeting on Thursday. And in all these plans, they are buying in. If any MEC or any province doesn't buy in, then they must tell us so in the National Health Council. And up to so far, they are buying in. The fact that some of them might be failing to implement does not necessarily mean that they are not buying in. It might be that they are failures within their systems, and we're looking at that.
All right, so we'll continue to explore this, because I think there's certainly a disparity with some of the provinces. Some are not performing as well as others, and in fact, national government has taken over the control of some of them.
Yes.
We'll find out why after this break. Stay with us, and don't forget you can participate at home in this conversation as well.